Hi everyone, Dr. Sylvestre here. I want to talk to you about the Robert Jones bandage. So we're going to watch Jennifer apply a Robert Jones bandage to the hind limb of a dog. And once she's done her demonstration, I'm going to tell you why I no longer use the Robert Jones bandage and what I use instead. We're going to pretend that this golden retriever has a tibial fracture. Jen is showing the roll of cotton that we have. It's not a particularly thick one, so we don't need to split the thickness, but when they're really thick, we'll actually split the thickness because then it's easier to manage. She is going to cut this 1 pound package of cotton into approximately 30-inch strips. Again, only because it's easier to manage than trying to unravel that entire roll around the leg. So you can maneuver your cotton padding easier if you cut it up into strips. That's the first thing that makes this job easier. The next thing she's going to do is apply stirrups because the Robert Jones is a very heavy bandage. And there's no way you're going to be able to see the toes without stirrups. Note that a Robert Jones is really, the intention is really there to immobilize a fracture and decrease the swelling. It is considered a temporary bandage. To do that, to immobilize the fracture so the patient is more comfortable and to reduce the swelling until the patient can either go to surgery or have a proper splint applied once the swelling has gone down, or a cast for that matter. But you don't want to apply your final cast or splint to a very inflamed, swollen leg, because as the swelling goes down, your cast or splint will just loosen. So notice that she unraveled one roll around the distal portion of the limb, and because we're dealing with a tibial fracture, she needs to go above the stifle. Note here that she actually took one of her strips and cut it again, just ripped it into a smaller strip so she can totally get the limb covered from the toes to well above the fracture. To make the bandaging, the padding a bit more even, she's just applying more padding towards the distal limb. It's just about getting it even. The important thing is you want a lot of padding when you do a Robert Jones. Now she's applying her cling. She started kind of midway along the metatarsals, and because if you go too low, it just tends to slip down. So she started mid-metatarsals and then went towards the toes and then started to really compress her way up. You have to apply a lot of tension in order to properly compress this bandage. The good news is that because of all the padding, there's no way that you can over-compress a Robert Jones bandage. So it requires a lot of padding, but you can really pull hard. She is going to use approximately 4 cling rolls to create this bandage. So just to give you an idea of the amount of material, we started with 1 pound of cotton, and 4 cling rolls is what she's going to take to create her proper Robert Jones bandage. Now she's going back, starting at the toes and moving up. What she's trying to do is even out the tension that she's applied to her padding so that we're going to have a nice even tension throughout the bandage itself. Even tension is always the key to have a comfortable bandage. We're just going to watch her finish off with the cling, and before she applies her vet wrap, her protective layer, she is just going to ping her bandage just to make sure she feels she's got a nice, sturdy, strong Robert Jones bandage. Beautiful. And there we go. It should sound like a pinging on a ripe watermelon is what the term that we use, but it gives you that kind of hollow sound. And then you know you've got a nice, strong, thick, well compressed. The sound comes from properly compressing all of this cast padding. And the final layer, after she's turned her stirrups over, is to apply the vet wrap. Once again, the vet wrap is the protective layer. It's just going to help hold the bandage together, keep it a little bit cleaner. It will offer a little bit of water resistance, and that's going to function for this dog. So once again, the Robert Jones here is a temporary measure for managing a fracture to help immobilize and reduce the swelling. Typically, it's used for tibial and radius ulna fractures. And once again, I much prefer it in the bigger dogs because in the smaller dogs, it's really quite a heavy bandage for these little guys. And there we go. Another beautiful bandage. I tend not to use the Robert Jones bandage for several reasons. One, it is a costly bandage to apply. It takes a lot of cotton. It is difficult to apply, and it's really heavy on a small dog. So I never use it on a smaller patient. If I use it, it will be on a larger dog. I tend to find it too heavy to apply simply to the metatarsals or metacarpals if we're dealing with a metacarpal metatarsal fracture. So I only use it for tibia or radius ulna. I much prefer to apply a splinted bandage rather than the Robert Jones. It's a little bit faster, it's easier. I don't have to stockpile a pound of cotton that I then have to tear up and cut up. And it takes a lot of pressure to really get it well compressed. So I do find that a splinted bandage is easier to apply, less expensive, and it will handle the swelling as well as stabilize your fracture.